I'm David Kerr. Welcome to today's dentistry. I'm one of the dentists and one of the owners of the practice here. We've got a clinical requirement to gather all the information we need about you. We've invested heavily in technology and equipment, so we've got a CT scanning machine or a cone beam imaging machine. We've got our intraoral scanners, intraoral photographs, a good clinical photography kit there, so we can really hone in and make sure that we understand your problems from a diagnosis point of view. We don't have to send you off anywhere else to get other information and then have it sent back. Intraoral cameras just gives us a very magnified view of some of the areas of concern that we find in the mouth. Our intraoral scanners are really the standard of care in terms of taking impressions. Now, in the old days, we used to fill people's mouth up with putty, and if you've had that done before, you know exactly what I'm talking about. Typically now use intraoral scanners routinely for simple crown and bridge work. We're able to do the preparation, the scan, the design, the milling of the crown, and the delivery of the crown in the same visit. We like to monitor our patients, so we've got software that allows us to overlay our intraoral scans year over year, so we can keep an eye on millimetre perfect what's changing in your teeth. We have the Diagnocam system that transilluminates the tooth and helps us review areas where we think there might be some tooth decay starting without taking x-rays. We've also got a cone beam CT machine. It's really a 3D X-ray technology unit that really allows us to get amazing amounts of detail about your dental problems. There's nothing that hides on these X-rays. We can preempt a lot of painful and expensive dental problems. With 3D dental X-rays, they really aid in our planning, particularly for dental implants. We use our cone beam machine, we use our intraoral scanners. We've got software that can merge those two data sets so that we can really plan where the implant needs to be placed and where the crown needs to be placed. In the smile design space, we also use this technology to redesign people's smiles that are facially generated. It allows us to do a smile test drive where we can use our 3D printers to produce our diagnostic models that we can actually try in the proposal before we even do it, and it really gives people a preview as to where the case is headed to make sure that we're all happy before anything gets done.